Hi everyone, Dr. Timothy Gallagher here,
And Dr. Michael Marciello.
and we're from Maragal Medical. Do you have shoulder pain? Have you gone to the orthopedist and were offered a cortisone injection? Well, this week we're going to learn why that's not the best option. Today we're going to talk to you about conservative treatment options that we have available to you here at Maragal Medical. It's going to be some great information, so stay tuned. All right, Dr. Mike, fall is in the air, fall sports. Ainsley's got a football game today. We're getting ready for the fall season. And whenever the fall season comes around, I always kind of go back to my high school years and I think about my senior in high school where I hurt my shoulder and I went the traditional route. I saw the orthopedist and I got a cortisone injection. Now we know, especially in the last year, the research that's available, particularly with cortisone injections where it causes more damage, the shoulder can respond a lot better to cutting edge treatment options that we have available at our clinic.
Absolutely. If we think about the reason, again, fall sports, as you described, is contact sports. That's what we're really thinking about. So there's trauma to the shoulder. There could be irritation or trauma to the nerves coming out of the neck into the shoulder. And so we look at all those factors. So first of all, we want to make sure you got the right diagnosis. Shoulder pain, we've been seeing a lot lately. The realities are they're coming in with what seems to be shoulder pain, but it really is coming from the neck.
Yeah.
So we want to make sure, first of all, you got the right diagnosis. And then we're looking at that soft tissue aspects of the muscles around the shoulder. That means the trapezius muscles, the shoulder blade muscles, all part of the rotator cuff. So we want to make sure we're looking at mobilization, some soft tissue management of trigger points, some laser treatment to help get some of the inflammatory process out, and good old just use some ibuprofen for a short time. But again, we're trying to minimize that injection because we don't want to have more harm later.
Yeah, and case in point, last night I had a consultation with a police officer who, injured his shoulder playing hockey, went to the orthopedist, got the MRI, and he's got a partial tear of one of the rotator cuff muscles. And the orthopedist had said, well, it's hanging on by a thread. It's like 25%. Let's do a cortisone injection. They did that in April, then they repeated it in May. And last night when I was talking to him, I showed him the MRI and I was saying, okay, think about it rationally. If you have only 25% of the tendon left, don't you think the last thing you want to do is introduce something that's actually going to cause more damage to that? It's almost like it's setting them up for surgery in the long run.
Yeah, the cortisone potentially can raise the risk of that tendon to tear.
Yeah.
So we think about, again, the damage is that it weakens the tissue that it gets injected to. So if you have an MRI that actually was perfectly clean and maybe some bursitis, cortisone may not be the worst thing because it's just getting the inflammation out, but it may not be necessary. But the last thing you don't want to do is to make the weakened tendon that much more weak to perhaps tear further. So that's why we're really always reluctant to think about injecting into a partially torn tendon, when in fact, we want the integrity of that tendon to stay healthy as much as it can be. And that's where we think about other injections and certainly starting simple before you get the cortisone.
Yeah, and those Wharton jelly allograft injections come in super handy. We know from the research that pre and post, injection documentation where you actually show and get to see that healing process over the course of 1 to 3 months, where that tissue thickens over time. And then personally, I've had great experience too. I had that partially torn rotator cuff. You and I talked about that. That was an injury 7 years ago, but the last thing I wanted to do is get a repeat cortisone injection, and that's when the whole process on regenerative medicine started for you and I. And to this date, we're almost 7 years after my injection, and you can see the details on our website. My shoulder's completely fine. We boost it 30 days later with a PRP injection, but what a great combination where we're using something that's completely safe, that also has regenerative or reparative qualities without the risk of any side effects.
Yeah, and we also don't want to forget about that neck and the shoulder blade muscles. So again, not only are we injecting perhaps PRP into the shoulder, all those muscles get really tight around the joints. So you're using your arm differently, you're tightening up those muscles and neck. So then we have the trigger point injections to calm those, again, tissues down, really, because that's a referred pain that really is no longer just shoulder. It's the compensatory processes of the muscle movement patterns. So we can reverse that with our chiropractic adjustments. We get the neck and the shoulder moving more comfortably, and that can also be a source of pain. So we don't want to always just assume that this is coming from your shoulder only.
Yeah, 100%. And usually that compensation with this patient, and then me personally, I can relate to that as well. Responded great to the Wharton's jelly and then the PRP, but then also the trigger point injections where it helps relax those muscles that have been working extra hard. You know, patients often know and describe that as a big knot in the muscle. That's just an accumulation of lactic acid in the muscle. Those trigger point or intramuscular injections are a great option. You know, again, we don't use cortisone like most clinics. We use a natural product called Sarapin. It's plant-based. It's actually an extract from the pitcher plant. So again, completely safe. And Dr. Mike and I, we're always thinking about more holistic, conservative treatment options that actually get to the root cause of your problem. And when we combine that with medical care, physical therapy, and chiropractic treatment under one roof, boy, you, the patient, have all the options available to you. And the best yet, we take most insurances. So if you or a loved one, or if you have a friend, or if you know an injured athlete that has injured their shoulder, please feel free to give us a call. More information can always be found on our website at maragalmedical.com. And certainly we have a wealth of information on our YouTube channel. And if you haven't subscribed yet, please consider subscribing. Well, that's it for today. I hope you learned something about conservative treatment options for shoulder pain. Have a great day, everyone.
Bye now.